Welcome to Module 2, Dangerous Driving Behaviors. In this module, we will discuss behaviors that significantly increase crash risk and can result in serious injury, death, fines, and license suspension in Maryland. Driving is not just about controlling a vehicle. It is about judgment, awareness, emotional control, and responsibility. The most common dangerous driving behaviors include alcohol and drug impairment, aggressive driving, distracted driving, drowsy driving. Each of these behaviors reduces your ability to make safe decisions behind the wheel. Let us begin with impaired driving. 1. Alcohol, drugs, and driving. Driving under the influence is one of the most serious traffic violations in Maryland. Impairment affects reaction time, judgment, coordination, vision, decision-making. Even small amounts of alcohol or drugs can affect your ability to drive safely. Alcohol restrictions. In Maryland, the legal blood alcohol concentration, or BAC, for drivers aged 21 and older is 0.07 to 0.08% for DWI, while 0.08% and above for DUI. DWI is driving while impaired, and DUI is driving under the influence. For drivers under age 21, the limit is 0.02%, essentially zero tolerance. However, it is important to understand this. You can be arrested for DUI or DWI even if your BAC is below 0.08% if your driving ability is impaired. Alcohol slows brain function. It reduces coordination. It affects depth perception. It impairs decision making. Many drivers believe, I only had one drink. I feel fine. But impairment begins with the first drink. Controlled Dangerous Substances, CDS. Controlled dangerous substances include illegal drugs such as marijuana, cocaine, heroin, prescription medications such as opioids, sedatives, anti-anxiety drugs, certain over-the-counter medications that cause drowsiness. Driving while impaired by drugs is illegal, whether the drug is legal or prescribed. Prescription medication may be legal to take, but it may not be safe to drive. Always read warning labels. If the medication says may cause drowsiness, do not operate heavy machinery. That includes driving. Open alcohol container. Maryland law prohibits open containers of alcohol in the passenger area of a vehicle. Drivers from possessing an open container. Passengers from consuming alcohol inside the vehicle. An open container means the seal is broken. The container has been opened. There is any amount of alcohol remaining. Even if the driver is not drinking, an open container violation can result in fines. The safest rule: no open alcohol in the vehicle. Transporting children. Driving under the influence while transporting a child increases penalties. A child depends entirely on the driver's judgment. Impaired driving with a minor in the vehicle may result in enhanced criminal charges, greater fines, possible child endangerment charges, involvement of child protective services. Driving impaired does not only endanger you, it endangers everyone in the vehicle, especially children. 2. Aggressive driving. Aggressive driving occurs when a driver commits unsafe behaviors deliberately. Examples include speeding, tailgating, running red lights, weaving in and out of traffic, failing to yield, blocking other vehicles. Aggressive driving often begins with emotion, anger, frustration, impatience. But emotion does not belong behind the wheel. Road rage is an extreme form of aggressive driving and can include yelling, threatening gestures, intentionally cutting off other drivers. Physical confrontation. Aggressive driving increases crash risk and often results in severe collisions. In Maryland, aggressive driving can result in points on your license, heavy fines, possible license suspension. Safe driving requires patience. Remember, arriving safely is more important than arriving quickly. 3. Distracted driving. Distracted driving is any activity that diverts attention from driving. There are 3 types of distraction: visual, taking your eyes off the road; manual, taking your hands off the wheel; cognitive, taking your mind off driving. Using a cell phone combines all 3. In Maryland, handheld phone use while driving is prohibited. Texting while driving is illegal. Even at a red light, using a handheld device may result in a citation. Looking at your phone for 3 seconds at highway speed means driving the length of a football field blind. Other distractions include eating, adjusting GPS, talking to passengers, grooming, reaching for objects. Driving requires full attention. No message is urgent enough to risk a life. If you must use your phone, Pull over safely. Park, then use it. 4. Drowsy driving. Drowsy driving is often underestimated. Fatigue affects driving in similar ways to alcohol. It slows reaction time, impairs judgment, reduces awareness. Warning signs include frequent yawning, drifting between lanes, missing exits, difficulty remembering the last few miles driven. Drivers most at risk include shift workers, long distance drivers, drivers who sleep less than 6 hours, drivers taking medications that cause drowsiness. If you feel sleepy, pull over safely. Take a short nap. Switch drivers if possible. Coffee is not a long-term solution. Opening windows does not eliminate fatigue. Sleep is the only true cure. Dangerous driving behaviors are preventable. Alcohol and drugs impair judgment. Aggressive driving increases risk. Distraction reduces awareness. Fatigue slows reaction time. Safe driving requires self-control, planning, awareness, responsibility. Before you start your vehicle, ask yourself, am I alert? Am I calm? Am I sober? Am I focused? Maryland roads are shared spaces. Every decision you make behind the wheel affects others. Choose safety, choose responsibility, choose life.